talk a bit about quad and hip flexor tightness. Tightness that continues to come back even after stretching. All right, so this can be just a really common problem that a lot of people experience. And there is something we can do about it. So I got this question in, and it basically was my hip flexors and quads are very tight. I feel like I have good quad strength, but my hip flexors feel very weak. When I don't stretch my hip flexors and quads, it feels like they're pulling on my back, and it leads to low back pain. Sometimes my glutes will get tight, and releasing them also helps with the pain. Do I need more hip flexor strength? Okay, so this is such a great question because I love how this person is actually kind of going deep in their body. So let's take a look at that. Now, there's a couple areas we're going to go through and look at. One of the areas, I'm going to kind of maybe start at the top down, is what is the rib cage movement looking like? Do your ribs move really well out to the sides, which means you get good back expansion? So I find a lot of times when we have back tightness, especially from hip flexor pulling, we don't have adequate back expansion with our breath. All right, so I would want to take a look at that first. What does your pelvic tilt look like? Do you tend to sit more forward into an anterior pelvic tilt? This can put a lot of strain on, obviously, hip flexors and quads pulling you forward, and then this can put a lot of strain on your back as well. So we're going to want to work on fixing that anterior tilt if you tend to be in an anterior tilt. Now, a lot of times I'll find people that will grip their deep hip rotators or grip their glutes to try to pull themselves out of that anterior pelvic tilt because their back does hurt. And they find when they grip and kind of tuck under and kind of move this way that it relieves a little bit of that stress off their back. But I don't want you to have to go into that overboard posture to try to get out of that pattern. I would prefer for you to use purposeful muscle contractions to help reset and redo that. And one of the ones I like is the Form Friday. The hamstring bridge can be really good for doing that. There's also a passive exercise. Passive just means you're not using a lot of muscles to do it. It means it's passive. And there's a full squat from the PRI that I really like as well. So I will link both of those in the swipe up in the bio for you. All right, so when we look at that pelvic tilt and then maybe that compensation with tightness in the glutes, you said that you feel better after you release your glutes as well. But what I'm suspicious of is that maybe it's not your glutes that are very tight, especially not the glute max. I tend to see a very strong, just good glute max muscle doesn't tend to hold a lot of tightness in it or tension. Normally people don't get complaints about that. But what does happen is if you tend to maybe tense more the deep hip rotators or maybe glute medius over glute max and those deep hip rotators, then you can tend to get a lot more tightness. Now, if you have deep hip rotator tightness, that's gonna shove your femur forward in the socket. And what do you think that's gonna do to those hip flexors? So if my deep hip rotators are tight, and that's shoving my hip forward in the socket, then my psoas is going to be my primary hip flexor. It's going to be what's going to maybe try to hold it back or rein it in. So then you get this poor psoas that's getting crammed forward and overworking to help try to center your femur in the socket because it's getting a lot of that forward pressure from those tight deep hip rotators. And that might be why you're getting that pulling on your back, is because your psoas is always having to tighten down to help keep your hip in a good place, help keep your hip stable. All right, so I would just check on that to make sure that you have better glute max than you do deep hip rotators showing up to help stabilize at your hip. All right, the other thing I want you to take a look at is hamstrings, glutes, posterior chain versus quads. So people who tend to be very quad dominant, I tend to notice that they use their glutes and hamstrings, so this posterior chain, less to do their hip extension work, and they tend to be more knee extenders. So what we want to look at is, do you try to force this motion, hip and knee extension when it happens together, from your quads more than from your glutes? Okay, so the Posture Restoration has an institute has an exercise that I love for this, and it's a sideline wall press where you focus on pressing into the wall from your glute and hip instead of your quad. But you can also kind of take that theory and move it into other exercises, like when you're doing squats or lunges or anything with your lower body, you can think glutes, hips coming up, knees follow. So it's not knees and then hips, it's the knees. Okay, so you get that little subtlety of what's kind of showing up first and where you initiate that motion from. And I tend to find people who are a bit more quad dominant tend to initiate that motion from their quads instead of from their glutes and hamstrings for that hip extension. All right, so give that a shot and just kind of think through that and see if you maybe tend to be a little bit more quad dominant. This tends to come out, especially if somebody's a runner. I'll really see this with that pattern kind of overloading. All right, so give those exercises a try, give that run through a try, and see if that doesn't make a little bit of sense. Then lastly, I do think that hip flexor strength is absolutely needed and important. I just tend to add it on as more of my last layer. So if your deep hip rotators are shoving your femur forward in the socket and you've got that pocket back here, when you have that tightness, you tend to have more of a pocket here and your femur tends to sit a little bit forward. So if you notice you have that pocket, compare your sides. All right, does one side have more of a pocket than the other? And you can be like, oh, it does. One side has a deep pocket, the other side doesn't. That tends to be maybe the side that feels a little bit tighter in the quad and the hip flexor. Then you know, okay, my poor hip flexor is just trying to battle those deep hip rotators. So if we don't fix what's happening in the mechanics of the hip first, and then we just try to strengthen hip flexors, I think you're just gonna end up with more tightness. So what I wanna see is get that fixed, get that glute firing, get that hamstring firing well, calm the quad down a little bit, and then I would add in that layer of hip flexor strengthening after that, because I think that'll be less likely to aggravate your hip.